Biotin is in pretty much every hair growth supplement I've ever seen, but is it possible it might have other effects in the body, such as helping multiple sclerosis? Well, maybe. In this quick video, I want to help you get a sense of the lay of the research landscape as it pertains to biotin helping multiple sclerosis symptoms. And if you've never heard of this before, hopefully this will be an enlightening video, because this is actually something that is being talked about in the multiple sclerosis community. So I want to basically look at the research, give you the pros and cons, and help you see if biotin is right for you. So without further ado, let's just jump right into it. Here we've got a study provocatively titled "Is there a link between vitamin B and multiple sclerosis?" These researchers looked at it's actually a review article, by the way. They looked at the research of a variety of different vitamins, B vitamins, as it pertained to MS. Ironically, they've actually highlighted vitamin B12 specifically and its role of remyelinization, reformation of myelin fatty sheath around the brain cells, and interestingly, reversal of MS symptoms. That's going to be a video for a future day. But what do they got to say about biotin itself? Well, they're great when they say that biotin's pretty much rarity in terms of deficiencies, because it turns out we make this stuff courtesy of our gut microbiome. They make biotin and we use it to our advantage. Now, they do go on to say that if someone is deficient in biotin, however, they may suffer some neurological symptoms such as muscle pain and tingling and numbness in the fingers and toes and stuff like that. Interesting, because these are some symptoms that people with MS also suffer from. That's intriguing. They go on to mention this intriguing study of 170 people with a variety of different issues, MS, dementia, epilepsy, etc., and they measured their cerebrospinal fluid, the fluid in their spinal columns essentially, and noted that only people with multiple sclerosis had significantly low levels of biotin in their cerebrospinal fluid. That's really interesting, because it kind of makes you wonder if people with MS might be deficient in biotin for some reason. It's possible, again, this would be another topic for a future video, but it lends credence to the idea that maybe biotin may be something that could help MS. So what's the research say on this topic? Well, we've got this investigation from 2015, high-dose biotin in chronic progressive multiple sclerosis, a pilot study. This is apparently the study that got everybody buzzing and beginning with about MS and biotin supplementation. 23 people with MS are given 100 to 300 milligrams of biotin a day for up to 3 years. The average length of time they took it was 9 months. And they noted that some of these people, about 17%, about 4 people in this group, noted significantly better vision when they took biotin. Very interesting study. I do like to point out that a problem with it is it's uncontrolled. It's not blinded, there's no placebo and stuff like that. So that lessens the importance of the study, but it is very intriguing. They noted that biotin seemed to be helping people. So a very intriguing study. What else we got? So we've got this investigation from 2016, MD 1003 for the treatment of progressive multiple sclerosis, a randomized double-blind placebo-controlled trial. Now we're talking. This is a much better program designed than the previous one. And before we go any further, I want to point out MD 1003, this is essentially a biotin drug. It is made by a company called MedDay Pharmaceuticals, and they sponsor research and support research on their drug, their biotin drugs, such as this one. These patients, who were 154 people, were basically given either MD 1003 biotin or a placebo for a year, and they noted that in some of these people, 13 of these individuals specifically, they showed significant improvements in their multiple sclerosis symptoms. Interesting compared to those who got a placebo. So that's quite interesting. I do like the fact that it's a year-long study. I like the fact they had a placebo. Again, only 13 of these people, we assume that they took these 154 people and split up into 2 equal groups, that maybe 77 per group. Only 13 of them showed improvement. Okay, not the miracle, but maybe something is happening in some of these individuals. So that's intriguing. So if biotin really works, how does it work? Well, if we go back to the original 2015 investigation, these researchers noted that biotin might help us produce energy in the axons of brain cells. Axons are the parts of our brain cells that conduct electrical impulses to our limbs, and they are affected in the process of multiple sclerosis. It's also thought that perhaps biotin may play a role in the remyelinization process, myelin being the fatty covering that covers the axons that is damaged in MS. At the end of the day, there's really not a good explanation why biotin might work, but this is the theory that a lot of people tend to put forth. So take it for what it is. In future, I'm sure there will be more concrete theories. I do want to be upfront and say that not all investigations show positive outcomes from biotin. So again, I want you to go into this eyes wide open. So for instance, we've got this investigation from 2017, high-dose biotin as a treatment for progressive multiple sclerosis. 43 people are given biotin for 1 year, essentially, 300 milligrams a day. Unfortunately, no benefit from biotin supplementation. And again, we've got another study, this one of that MD 1003 study, or product I told you about a while ago, 300 milligrams of MD 1003 a day or placebo, no significant benefit, unfortunately, with the product again. So what do we got when it comes to biotin? Well, the research is kind of mixed at this point. We've got some studies showing it may work a little bit in some people, and some studies showing no benefit whatsoever, unfortunately. On the plus side, biotin is pretty inexpensive. You don't necessarily have to go out and run out and go get a weapons-grade drug-quality biotin to see if it works or not. Biotin's at every health food store in the universe. Overall, if you're healthy, it's fairly safe. I don't know if any long-term effects of biotin in healthy people for the most part. Although in people with MS, we don't know long-term results of this. For instance, if someone was taking biotin for 3 years, could there be some down the stream long-term effects? It's possible. We just don't know yet, unfortunately. The studies are not there yet. I do like to point out that if you are getting any blood tests, for instance, hypothyroidism sometimes comes up when you talk biotin. Biotin may alter the results of some blood tests. For instance, hypothyroidism might make it seem like you have hypothyroidism when you really don't. But overall, I think overall, for the most part, it's going to be pretty safe for most people. But again, since you have MS, I think talking to your doctor about this is a pretty good idea. Get the lay of the land and find out if it might be right for you. If you've tried biotin, guys, I hope you'll leave a comment. Let me know what happened, because I find this very intriguing. I've worked with people with MS in the past, and I know how serious this disorder can be. If you have any questions, leave them below and I'll answer them myself. Until next time, guys, it's Joe Cannon. Have yourself a great day.